Good morning, everyone. Lisa from My Healing Place Complete Counseling Care. Shenzi's in the background with me today. For those of you who know, Shenzi is our therapy dog, and she decided to join me in the video. So I thought, well, I'm going to leave her here because she's part of our agency. May is Mental Health Awareness Month, and I want to talk a little bit about this. I struggle with the fact that we have to have a Mental Health Awareness Month because it just, again, continues to indicate the stigma that is attached to mental health awareness. So I'm going to do a little lesson for all of you right now, and I know this is not going to be a shocker, and yet it seems I have to continue to say this. I don't know if we all know this, but our heads are attached to our bodies. And inside our heads are these things called brains. And these brains run all our body from our heads, top of our head down to our toes. And so when we separate this from mental health to physical health, we're somehow differentiating these are two different things. When the reality is they're all health disorders. So if we have to call something something, I would rather we say health disorders or physical health disorders to mean everything versus separating them, like pretending that this is somehow different than this and that these two things are not connected. So if your mental health is not doing well, there's a high probability your body is not doing well either, since, they're connected. If your physical health isn't doing well, there's a high probability your mental health isn't doing well because, again, they're connected. So we need to really move away from this. One part of our body is different than the other part of our body because it continues to add to the stigma of what people feel and why people do not go get help. I spend way too much time convincing people that medication really is going to be the thing that is going to assist them. Now, please don't get me wrong. I know that there are people who have mild depression or mild anxiety and that can be really managed through symptom control of behavioral changes, and I'm not having a problem or issue with that. I am talking about the people who are truly dealing with severe anxiety, severe depression, bipolar disorder, schizophrenia, OCD, these people who really, truly probably will need to be on a lifelong medication management to help them function within their lives. Now, here's the problem that I keep running into. I tell this to people. No, I can't be on medication. I don't want to be on medication. Well, how come? Well, because that's just good. I don't want anyone to know I'm on medication. They're going to think I'm crazy. Okay. So now let's flip that of I'm a medical doctor. And I say, you have diabetes. So we're going to need to put you on metformin, insulin, depending on what your diabetes level is and what you have. And so this is going to be to help your pancreas be able to balance and regulate your insulin a little better because your sugars are either too high or too low, and either of those can be a problem. So are you going to be okay with having to start medication for that? Now, granted, not people aren't always happy, but it's rare that people will say no to that, and nobody really feels embarrassed by that. They talk about their diabetes, or I'm sorry, I can't eat that because I have diabetes now and I got diagnosed, and here they go into the whole thing, and I'm on metformin or I'm on insulin and this is what I got to take, and nobody blinks an eye. Not a problem. But never have I sat at a dinner party and heard this. Oh, I'm sorry, I can't have that drink today because I'm on medication for that. And so my antidepressant medication really recommends I don't drink while taking it because it can impact the effects. I'm on this because I have major depressive disorder, because my brain has this chemical imbalance in it that is genetic and nothing I've had control over. And so as long as I stay on my medications, I'm staying really stable. But when I go off my medications, I get into a very deep depressive state and I become suicidal. Doesn't happen. Just doesn't happen, which is unfortunate. It should be that normal to talk about your mental health as it is your physical health, and yet it's not. And so I'm here to hopefully try to end that stigma. And this video is really going to be about challenging those out there who follow these stigma beliefs, including persons themselves who might be diagnosed with the disorders, to really ask people why. Why is this such a big deal? I don't get it. Your brain is just an organ within your body. It has a chemical imbalance like any other organ that has a disorder, heart disease, diabetes. If you have kidney issues and need to be on dialysis for that, any liver function issues, bladder issues, any of those different organs within our body And yet we don't think anything weird about that. But the second we talk about mental health, it becomes embarrassing. It becomes shameful. It becomes a stigma. And that's because of this separating the brain from the body, but it's all one thing. The other thing is insurances do this too. So for an example, United Healthcare, yes, I am calling them out, which is under Optum for behavioral health. So that'd be United Healthcare, UMR also falls under those. United Healthcare, Medicaid falls under those. So they have decided, what they were going to decide as of April 30th, that anybody that had telehealth benefits that they were given during the pandemic, they were going to stop those. But they've extended that now to June because the pandemic, the Department of Health and Services extended it, so they extended it also. But there's this thing in our country called parity law, which means whatever you get for medical health, you're supposed to get for mental health too. And yet United Healthcare doesn't seem to do this, as well as a few other insurances. So even in our insurance, which we all know is another whole big topic, but even within our insurance, there's this differentiated between medical and mental health, which makes no sense because the brain is part of the body. It's all part of the physical health. So same reason I don't understand why you have dental insurance and eye insurance when our eyes, our ears, our teeth, all part of our body. And yet we break these things out differently. So what this stigma does, unfortunately, is prevents people from coming to get help, prevents people from taking medication that truly, truly will relieve the distress, and prevents people from telling people that are their loved ones what's going on in their life to get support. That's what the stigma does. It doesn't help them. Things like, well, you just need to get out of bed, you'd feel better. Or, well, I think the problem is you're always so worried, just calm down. Or, you know what you just need to do? You just need to get out with friends a little more, and then you wouldn't be so anxious all the time. Or, why are you acting like this? You're so manic. Like, what the heck? Slow down. These are things that if they could do that, they would do that. I sit with these individuals in my office and watch them with tears in their eyes, miserable because of these symptoms that they are experiencing. And often, not always, but often without the support of their loved ones. Even well-intentioned people sometimes say or do things that are hurtful. Some of that revolves around medication. Yeah, I believe you have major depressive disorder, but you really, medication, no, you don't need medication. Medication's for people who are like crazy or weak. You don't need that. You just need to stop doing what you're doing. Again, if they could, they would. And so medication really needs to be seen as part of the management of a disorder, just like any other kind of medication is seen as part of the management of a disorder. Now, again, certainly there are many things people can do. Get good sleep, eat a healthy diet, get exercise, get out in the world and do social events, have some hobbies, spiritual or religious belief systems. There are many different factors, job satisfaction. All of these things definitely help our mental health. But it's hard to get to those things if your mental health is so impacted, you're so depressed, you're so anxious that you are crippled by it. And medication is a way to help fix that. But we have this stigma about medication. I also spend a lot of time with parents trying to convince them that their child truly is at a level of where we are now talking medication. And believe me, I am not a therapist that jumps to medication first. I think a lot of children are misdiagnosed or overdiagnosed in certain disorders. So it's not where I jump to first. But when I come to the conclusion of this is now where we're at, or I have a child so deeply anxious, so deeply depressed, even as they walk through the door, and I'm having to spend way more sessions convincing parents that this is really what needs to happen, in addition to therapy, to help their child improve and feel better, that's frustrating for me. Because what I see is a child in significant distress, trying to manage every day, oftentimes with parents who think they're being helpful, but actually sometimes are being hurtful and or not helpful. And it's sad to me because, again, there's a way to help manage this distress for them. So why is it that we look at this way? Well, because of these stigmas. We do not want people to know we have mental health disorders. I myself, back when I was in my mid-20s, had a significant, major depressive disorder bout. Now, I've been really fortunate that I've had a single that major. I do have depression at times. I certainly am a person who struggles with anxiety. I've learned to manage a lot of that and have been fortunate that I've not had to get back on medication. But if I had to, I would, without even thinking twice about that, because I don't want myself to feel that distress. Fortunately, I've been able to manage my symptoms through, like I just spoke of, health, and I do a lot of meditation, yoga, things that I teach, mindfulness, I teach my clients. But if I needed to be in medication, I absolutely would. I absolutely would. I talk about my mental health with my clients as far as trying to help them see this is normal. You don't need to hide it. You don't need to pretend there's nothing wrong with you. You don't need to be ashamed of how you feel. So my wish, my 2021 wish, is that we stop making people feel bad for having disorders that is not their fault and they did nothing to create, and help support them and learn about this. There are great organizations out there that have a great amount of information. NAMI, National Alliance of Mental Illness, is a really good resource. But this is the age and day of technology. You can Google something about how do I support somebody with fill in the blank, and it will pop up tons of information, tons of agencies that are there to help support this. And get information about medication. Go to places that are reputable sites when you do this, things like the CDC or Mayo Clinic or NAMI has good information, and really learn about how I can support the person that in my life that might be suffering with a disorder. And for those of you who are suffering with a disorder, get help. Stop suffering. Get some help. It's okay. There's nothing wrong with you that you can't go get help for and can't feel relief from. So if there's anything that I want people to walk away from this particular video is mental health is not a special disorder. There's nothing shameful about it. Medication can assist and will help manage the symptoms better. And you deserve to have a fully functioning, happy life. Take care, everybody, and I'll see you next time.